Hello everyone, and thank you for taking your precious time to attend this presentation. My name is Daekook Nekar. I'm a research assistant at Sunman University in the Department of Physical Therapy. Today, before I start with my presentation, I would like to thank all the organizing committee for this opportunity they gave us to share our research. Today, I'm going to talk about using game contents for children with developmental disabilities. And the title of my presentation is The Effects of Cooperative, Competitive, and Solitary Exergames on Cognition and Anxiety Levels in School-Age Children with Developmental Disabilities. So before I talk about the methods and the results we found in our research, let me give you a brief introduction about the topic. First of all, developmental disabilities, or DD, are a category of health conditions that are generally caused by physical impairment, cognitive function decrease, and also problem in learning and language abilities, and also in behavioral domains. And individuals with DD present deficit in many domains such as attention, memory, reasoning, problem-solving abilities, and also in social interaction deficit. So in many cases, they have a restricted participation in social activities that result in social isolation and also in increase of anxiety. So children with developmental disabilities have a high level of anxiety, which is one of the main problem of children themselves and also for their parents. It's also related with a panic and confusion, a feeling of stress, activation of autonomic nervous system, and that may also affect their skill performance and their functionality. However, although adult and some normal developing children, they may respond positively to face-to-face intervention, but children with developmental disabilities have difficulty to express themselves verbally, and therefore they need a different type of approach during the therapy session. So talking about the new type of intervention approach, games have essential value for children regarding health development and may be used to create an adequate environment to socialize, to develop cognitive skills, and also to decrease anxiety. So recently, Exergames, which is a combination of exercise and game, are playing a capital role in healthcare and rehabilitation field for improving health conditions and also including but not limited to physical activity, chronic diseases, and cognitive function. So generally, there are three common types of game, which are cooperative, competitive, and solitary games. Cooperative games require players to participate in a game as a team, while competitive games are those which players play against each other and where one player winning means another player loses. And solitary games play alone and the goal of the player do not impact the result of the other players. Although there is a lack of evidence on the effectiveness of competitive and solitary games on cognitive function and anxiety, especially for children with DD. So there is a need to develop and determine how cooperative games affect children with developmental disabilities, particularly in cognitive outcomes and also in anxiety. So the main question here is whether all type of games have positive effect on cognitive function and anxiety in children with DD. And also it will be interesting to know which of the cooperative, competitive, and solitary games is more effective to improve cognitive function and anxiety in children with DD. So the purpose of our study was to compare the effects of cooperative, competitive, and solitary games on cognitive function and anxiety in school-age children with developmental disabilities. So the possible implication of our study is that our findings will provide evidence of the effective game type that can practically be used to improve cognitive function and decrease anxiety in children with DD. And also it will provide directions for future research to design and customize Exergames for children with DD. In order to conduct this study, we used a randomized control trial, pre-test, post-test design with 3 groups, and we conducted on 30 children between the age of 6 and 16 years old. Written consent was provided by parents because all the participants were minor, and the study followed the principle of the Declaration of Helsinki, and it was approved by the IRB of Simon University. And the inclusion criteria was to have a developmental disability diagnosis or to exhibit some of its symptoms, not having any issue with vision, hearing, or following simple directions. And the exclusion criteria was children with severe genetic conditions and those who were not able to follow the instructor direction or unable to stand by themselves. So here we have the study flow diagram, and as you can see, we first assess the participant for eligibility, and none of them were excluded from the study. All the participants were allocated in 3 different groups: the cooperative game group, the competitive game group, and the solitary game group. We perform also a baseline assessment followed by the intervention session. All of them participated in the intervention session 2 times a week for 8 weeks, followed by a post-intervention assessment and the data analysis. And here in table 1, you can see the general information of the participant, the age, the gender, the education level, and the diagnosis, and also the frequency of the video play. So next is the outcome measurement. In our study, we measure the cognitive function as well as the anxiety level. So for the cognitive function, we use the computerized cognitive testing program, FoCoS.IDIC, to assess various cognitive functions. The FoCoS.IDIC is capable to measure 6 specific domains related to cognitive function, which are orientation, memory, attention, visual perception, language, and high-level cognition. So the FoCoS.IDIC included 29 items that took around 10 to 15 minutes to be completed, and the score ranges from 0 to 100, with a higher score indicating a higher cognitive function level. For the anxiety level, we use the Spence Children Anxiety Scale, and the scale that we used was the parent-rated scale. So it assessed the 6 domains of the anxiety, which are panic attack and agoraphobia, separation anxiety, physical injury fears, social phobia, obsessive compulsive, and also a generalized anxiety. So here are the games that we used in this study. So first, all the participants had a 8 weeks training program with 2 sessions of 30 minutes per week. The Exergame program were performed using the Yeon game software with a Kinect sensor in a large training room. So for the cooperative and competitive game session, participants played the game in pairs that were chosen at random, and the game difficulty were gradually raised in accordance with their performance. And for the solitary game also, the participant played the game alone, and also the difficulty was gradually increased, and an instruction was given by a pre-recorded video, and also a feedback was given during the performance of all the games. Next is the statistical analysis. We use the SPSS version 26 for Windows, and we perform a descriptive statistic to analyze the general characteristic of the participants. We used a Shapiro-Wilk test to analyze the normal distribution of the data, and we conducted a pair sympathy test for a comparison between the pre-test and post-test within the group. and we conducted a one-way ANOVA to compare the groups between each other, and we performed the Brinfoni test for the post-hoc test. And all the significant level was set as p less than 0.05. So here are the result of our research. This table shows the result of the cognitive function before and after the intervention within the group and between the groups. First, we have orientation, memory, and attention. For the orientation, as you can see, we didn't have any significant difference within the group in all the three groups, and also we didn't have any significant difference between the groups. For the memory, as you can see, we had a significant difference within the groups, and for the cooperative game group, we had a p-value of 0.03. For the competitive group, we had a p-value of 0.04, and for the solitary group, we had a p-value of 0.02. And also in attention, we had a significant difference in all the groups within the groups, and also we had a significant difference between the cooperative group and the solitary group, and also the competitive group and the solitary group, as you can see here, the p-value. This is the continuity of the cognitive function result. For the visual perception, we had a significant difference in within group in all the three groups, but no significant difference between the groups. For language, we had only a significant difference within the cooperative group, and a significant difference between the groups, the cooperative group and the competitive group, the cooperative group and the solitary group. And for the high-level cognition, we didn't have any significant difference within the group and between all the groups. Here is the result of the anxiety level before and after the intervention within and between the groups. So first we had the panic attack and agoraphobia. The within group comparisons show a significant difference in the cooperative group, and no significant difference between the three different groups. For the separation anxiety, we had also only significant difference within the cooperative group and none in the two other groups. And we had a significant difference between the cooperative group and the competitive group. And lastly, in the physical injury fears, we had a significant difference within the cooperative group and the solitary group, but we didn't have any significant difference between the three groups. Next, for the social phobia, we had a significant difference during the within group comparison in all three groups, but we didn't have any significant difference between the three groups. For the obsessive compulsion, we had a significant difference within the cooperative group and the solitary group, and a significant difference between the cooperative group and the competitive group. And lastly, for the general anxiety disorder, we had a significant difference in the cooperative group and the solitary group, and a significant difference between the cooperative group and the competitive game group. So to discuss briefly about the findings of our research, we can say that Exergames, which combine physical and mental challenges, is well-known explanation for this phenomenon because it stimulates the brain both in physical and mental way. It places a higher demand on brain and also a higher neuroplasticity. So in addition, participating in Exergame require mental process such as imagination, thinking, emotion, which may promote a various aspects of cognition and also to reduce the anxiety level. So for children who participated in cooperative and competitive games, they had their partner physically present at the same location as them, which may increase their attention not only in the performance of the games but also in the surrounding environment. And participants who had a higher demand on attention complete the game, and also to try to win the game over the other players. However, those with solitary games had less demand on attention, which may limit the performance and also the result of the game. So these are the findings of our research, but our research had some limitations. First, the intellectual level of the participant were not measured, and this may limit the generalization of our findings. And also the total number of the participants was very small. We had only 30 participants, 10 participants in each group. And also the long-term effect of the game was not assessed. So there is a need for further research that may compensate all the limitation of this research. So in conclusion, our results suggest that all types of games may be used to improve cognitive function, but only cooperative games may be used to improve verbal communication. And also cooperative and competitive games may be used to effectively improve attention compared to solitary games. And regarding anxiety, cooperative games are more effective, followed by solitary games, but competitive games may not have a positive effect on children with developmental disabilities. However, the type of games should be chosen carefully according to each children's special need and special conditions. So this is the end of my presentation, and thank you very much for your attention.